Hey everybody, Luke Gordon again, and we're looking at inversion tables again. So I just made a video about inversion tables and answering questions regarding do they actually work for things like lower back pain and sciatica. So hopefully you've had a chance to check that one out. Now if you're considering using an inversion table, in this video what I want to do is just show you basically how to use the table. There are some different ins and outs depending on which brand you get. The one that I'm using right now is a teeter hang-up. And this is a little more of like an industrial model that we use at the clinic. At home, I've got a different version that isn't quite so big and bulky. It's more for home use. So regardless, though, there's going to be some similar things that you want to do to adjust the table to make sure that it works for you. So I'm going to show you just the mechanics of the inversion table. And then I also want to talk to you about, especially if you're using it for back pain or sciatic nerve pain, how to start off in terms of how far should you go, how long should you be there, how many times a day and per week, and stuff like that. So I'll give you some of that information on the second half of the video. So first off, with an inversion table, most tables, the first thing I would adjust is how far back do you want to tilt. So there's different adjustments. So on the teeter, what affects how far back you tilt is this rope down here, this cord. So with this cord on, it's got these little, I forget what you call these little hooks. Carabiners. You got carabiners on this thing. So if you want to tilt back pretty far, you would use the longer carabiner, and if you want to tilt back not so far, you would use the shorter carabiner. So if you're new to inversion, I would set it on probably the shortest setting first, which should be around 45 degrees or so. So set that, and then just take a look after you set it and just manually see how far back is this thing going to tilt me. So again, from there, you're looking like probably 45 degrees or so. And again, if I put on the longer hook, it would give me more slack on the cord, and it would go back closer to like 75. Now, of course, on these tables too, you can just go all the way back if you want to. But again, if you're new to using an inversion table, don't go back so far at first. So set that thing first. On my table at home, it has like a bolt on the side, and that's where you set how far back you go, and the bolt like kind of catches the arm as it goes back. So whether it's the cord there or the bolt on the side, set how far back you want to go. And again, if you're brand new to it, don't go that far back the first time. Other good advice is probably have someone nearby the first time, just in case you go too far, can't get back up, whatever, have a friend or, a spouse or a responsible child or something like that. So set how far back you want to go. The next thing is that you want to set your height on the table. So most of the tables will have like a telescoping metal bar right here, and on this one it tells you how tall you are. And they're a little different to adjust depending on, again, the brand you get. But on this one, you have to loosen this whole area. You have to pull the pin, and then you can slide it and change your height right there. Since we're on video, it probably won't work for me, but you get the idea. So for me, what I recommend doing is I set it about like an inch shorter than I am. So I'm roughly 6 feet tall. So when I want to use this, I'll set it at 5'11". The thing you want to keep in mind is there's going to be some trial and error with this, because you want to make sure that when you are in the table, so you're strapped into the table, you want to make sure that when you're just resting back like this, that you don't just go flying right off the bat. I try to find like that middle fulcrum where you're just about to tip back, and then I'll have like the point where I can just raise my arms and go backwards like that. Apparently I don't have that set on my height. Nope, I'm not 6'1". But that's how, so set your height and then make sure that it's at a comfortable level that you can tip back easily and that you can come back up easily. Now, if you do tip back and then you're having a hard time getting back up, you can use the side handles to pull yourself back up, or while you're tipped back, if you try to like scooch your bottom down the table or like bend your knees, that will move your body weight on the other side of the fulcrum where you're tipping, and it'll tip you back up. So those are some little tricks and tips there too. So find the right height for yourself if you can. Again, have a friend nearby so they can help you if you need to. And then that's the second thing you do. So the third thing you do when you want to get on the table then, if you want to scroll down to the feet, is on this one you have these little pegs. You put your feet on the pegs. There's little cups in the back of your ankles, and then you tighten the top one. On the teeter, you push down and then pull it back. Some of them have just like a peg or like a pin, so it's like a spring-loaded pin. Either way, you get that nice and snug on your ankles. And just being snug, not like extremely super tight, should do the trick. and then from there you should be able to tip back. So that's how you adjust the table. Again, adjust your strap or your pin for how far back you want to go. Adjust your height so you're basically resting on the fulcrum. That way you can tip back and tip forward easily, and then strap yourself in and give it a go. Now, basic parameters for using an inversion table. In that first video, I talked about what to use it for. So like degenerative types of lower back pain, potentially sciatic nerve pain, and let's just walk through some parameters on how you would want to first start using it. Basically, you want to start slow. So again, don't go back too far at first. Have someone there in case you get, real painful or something. Start slow. And I would usually in the clinic, I just have clients go for like 2 or 3 minutes the first time, as long as it feels good. If it feels good, I say we're going to leave you there for 3 minutes. I'm going to bring you back up really slow, by the way. Because as you can imagine, when you're tipped back and you're strapped in at your ankles, what's happening is the weight of your body and your torso and your head and your arms is elongating your spine. It's decompressing. So you're sliding those joints and those discs apart, and you're creating more room for like the nerve roots and things like that, which usually feels really good. Conversely, though, when you get back up on the table, it's going to recompress. So come back up slowly. Don't just like slam up and like, oh, that feels great, like just a jolt of pressure to my spine. So come up slowly. So again, at first, I just recommend 2 or 3 minutes at a time, making sure there's no extra pain or adverse symptoms or anything like that. And then over time, I build people up to like 5 minutes at a time, 10 minutes at a time. And once you get a good feel for how it feels with your back, and you've had a chance to see how does your back feel not only the day you use it, but the next day and the next day, then you can start to go for longer durations or potentially go longer through a couple times a day or something like that. So with that in mind, I have people build up to like 10, 15 minutes is usually about where I top out with them. And they can do it every day at that point as long as they feel good and don't have any adverse increase in symptoms or anything like that. So that's the way I usually explain it. Last thing I want to mention is you do tend to get lightheaded when you first start using it. That'll adjust over time, but just be aware of that. So again, another important reason to start slow and don't just tip back really fast. You will get kind of like a not lightheaded so much as a head rush. But your pressure receptors can kind of compensate for that over time. So just go slow, have someone nearby, and build up as long as it's helping. It can be a really useful tool for people with chronic lower back pain with the degenerative problems like degenerative disc disease and degenerative joint disease. So if you want to give it a try, one last thing I'll mention before I go for the video is, I said it in the first video too, is I would recommend, if possible, you do it with a physical therapist first, just to be extra safe. But again, I know a lot of people watching the videos are trying to relieve their pain at home, so you don't have to. But if you have questions, or you have questions about like, is my back even stable? Is it going to be safe? Definitely get some help from someone who knows what they're doing. So that's the video. Thanks for watching. Please leave a comment or question below, and like and subscribe while you're here, and I will talk to you next time.